FASD stands for Fetal Alcohol Spectrum Disorder, and it describes the range of effects that can occur to an individual whose mother drank alcohol during pregnancy. The spectrum ranges from people with ADHD symptoms and learning disabilities to severe mental retardation. Alcohol is a teratogen that disrupts the developing brain of a fetus and can cause lifelong disabilities.
Well, when I was little, I kind of felt different, because I had to be held back in second grade. And it's like I kind of had, like other kids, it's like their work seemed to be so easy for them. For me, it seemed hard, and it's like I just didn't think like normal kids.
We are recommending absolutely no alcohol intake during pregnancy or during the period of time with breastfeeding. For some women, very small amounts of alcohol can cause problems with the fetus.
FASD is often undetected because the symptoms are frequently invisible. People with a normal IQ can have FASD and still have problems with hyperactivity, impulse control, memory deficit, and poor judgment. A fraction of people with FASD have physical characteristics such as short palpebral fissures, broad nasal bridge, midface hypoplasia, indistinct philtrum, thin upper lip, pointed chin, and a smaller stature.
The primary healthcare provider can be the person to make the diagnosis of fetal alcohol spectrum disorders. I think some physicians may be under a misconception that they need to refer this patient out to a specialist, but the doctor can do the diagnosis on looking at the history of alcohol exposure, can evaluate the typical physical features associated with this disorder, can also document the behavior problems.
In persons with fetal alcohol effects, you see very frequently that there is not that executive function that sort of stops their behavior.
Me and my mom, so it's like we walk around down the street. It's like we're at the cross street, but it's like, like for instance, I see that the light is red and you can't cross, and I see the car, but it's like I just can't stop. It's like I know, but it's like my brain doesn't think stop.
They don't understand cause and effect. They don't understand that some of their behaviors lead to very dire consequences. 40% of individuals with FASD are incarcerated. There's no other developmental disorder that has this high of a rate of incarceration.
Screen women for alcohol use and abuse. Counsel your patients about the risk of FASD. Discuss FASD with your colleagues.
Although we frequently think that the use of alcohol during pregnancy is isolated to persons in lower socioeconomic status, the fact of the matter is that that's not true. A good portion of the women who drink during pregnancy are actually women who have an income of $50,000 or over. They're frequently single women, and they're frequently women who have a college education.
For many women that are prone to addiction, if a physician says, oh, you can have 1 or 2 drinks per day to just relax, we know that some women cannot control this small amount of alcohol intake. And so it is not wise to okay a small amount of alcohol taken during pregnancy. It is very important for the healthcare provider, like the OBGYN who is working with a mother who is pregnant or thinks about being pregnant, to bring up the issue about alcohol use.
If one can screen and identify women at risk prior to becoming pregnant, this is the best of all possible scenarios to try and get women into treatment programs, into social support programs, and to a variety of other support programs that they may need.
Now, oftentimes, if there's a scared mother or a mother that hasn't made a good emotional connection with the physician, it's a hard thing to admit about alcohol use. So instead of asking, did you use alcohol during your pregnancy, one can ask about how many drinks a day took place during your pregnancy, in a very positive and nurturing way, to try to understand what influence this may have had on the child.
It's not fair that children should be, it's just not fair to them that they should have to deal with these disabilities when they don't have to. I don't want to have it, but it's like I just have to accept my fate, although it's like I really don't want to, but there's no way I can change it. It's like I just have to accept it, and I just have to say, I'm stuck with this for life. I just have to do the best I can to just live a full life.
We're not dealing with cure here. We're dealing with treatment of a chronic condition. And as all chronic conditions, early recognition, early intervention, and constant follow-up are the key. And make sure that you have in your office resources so that you can advise patients and you can provide follow-up for treatment and intervention.